Well, Dr. Dodson, thank you so much for agreeing to chat with me today. Super appreciate just all of your expertise and knowledge and experience interacting with the people that we interact with on a daily basis. So thank you so much for agreeing to chat. Very, very, very
Great.
appreciative.
Thank
Um,
you.
yeah, of course. So I would love to begin by just asking you this first question. How does trauma affect our friends experiencing houselessness?
It is probably the universal experience of everyone that we deal with. In order to have ended up on the street with no supports, no family, no nothing really, you have to have been through some pretty traumatic stuff, and then it continues to be traumatic and dangerous just because you're on the street. So this is going to be something that every one of our friends is going to share in common. And so it's going to be something that our volunteers are going to be confronted with everybody they deal with. That said, it's really hard to make generalizations about a human being's response to trauma. It so much depends on 1,000 different things. The person's genetic predispositions, pre-existing stressful experiences, pre-existing traumatic experiences, gender makes a difference. You name it, it's going to have a major effect on how each person experiences the traumas of their lives. There's an old saying that if you know one person with PTSD, you know one person with PTSD. No two people are the same. So what people need to at least start with is the DSM diagnostic features of post-traumatic stress disorder. Now, post-traumatic stress disorder is unique among all the diagnoses in that it is something that happens to you. It is not something that you are or that you have a genetic predisposition to or whatever. It has to do, number one, with having a terrifying experience happen either to you or if you're a witness to a terrifying experience. What that does is it turns on the fight or flight biochemical reactions in the body. The second thing you have to have is re-experiencing or flashbacks where you're just sort of walking along and all of a sudden something reminds you of the traumatic experience and boom, you're right back there. I had a patient who was just walking down the street downtown and a car backfired and suddenly he was back in Vietnam and he was in a business suit crawling underneath cars and shouting to people to take cover, and he fully re-experienced the most terrifying day of his life in Vietnam. As you can imagine, the next piece is avoidant behaviors, avoiding situations where those triggers might occur. It's a way of trying to gain control over the triggers. You can also do this, you'll see this by people who numb out or have anhedonia, the inability to experience pleasure. And so the features of PTSD swing from re-experiencing to numbing out to re-experiencing. And most people spend very little time in the middle. So you're going to find sometimes that something traumatic will have gone on and the person's just absolutely bland. Sometimes things will be going well and something will have triggered their panic and wham, they're back in the traumatic event. The next thing in order to get the diagnostic label of PTSD is that it affects how you think. And in particular, it negatively affects how you think. You become pessimistic, nothing's going to work out, no one is trustworthy, you're constantly on guard and vigilant for someone betraying you or experiencing everybody you meet as potentially dangerous. It's one of those things where usually something happens to us and we have a fight flight reaction. This is the reverse. We're having a fight flight reaction, so we're looking for the threat. And then lastly, persistent symptoms of physiological arousal. In other words, the person, the fight flight reaction is always on, no matter what's happening. And so pulse is high, um, shortness of breath, hand tremor, hair standing on end, um, getting sick to your stomach, that sort of thing. This whole plethora of physical experiences that are due to trauma. Um, so everybody, well, almost everybody, is going to be exposed to some sort of trauma in their lives. They're going to be in an automobile wreck or witness one or something like that. 50% of people will experience personal trauma. Um, they'll be held up, they'll be beaten, they'll be bullied, that sort of thing. So the question is, who develops PTSD and who fairly quickly recovers? And boy, then you really get into a whole bunch of factors. Um, the simple ones, of course, are severity, duration, and frequency. The worse it is, the more frequently it repeats, and how long you are in that traumatic event determine a lot about how much it's scarring to you and permanent. Um, but that's something you have no control of. It's sort of tied to the event. The biggest factor that determines who gets a PTSD and who comes out of it actually stronger is the person's belief about their own strength and what's called agency. Imagine two people who are in the war, they're in the same foxhole, they go through the same traumatic events. One person, however, believes they're going to die. There's absolutely nothing they can do to change their mortal peril. That person is very highly likely, due to the helplessness to save your own life, is very likely to develop post-traumatic stress disorder. The person right next to him who says, boy, this is a bad situation, but I've been through bad situations and mastered them before. I'm going to find a way to save my skin this time too. And if they survive, actually come out of the experience stronger because now they have met and mastered a life-threatening challenge. So it's not the event, it's what the person believes about their own ability to modify their peril and save themselves. Most children, in other words, when trauma happens to children, children are very well aware of how helpless they are. And so trauma that happens to children is going to be much more likely to turn on this adrenaline system, and they'll always be somewhat turned on. The second thing is going to be something that our friends are going to really be hurt by, and that is the lack of a good support system. By definition, they don't have any good support system other than dry bones. Dry bones is the only non-traumatized group of people that they have access to, that reaches out to them. Otherwise, what their support system is are other damaged people who are out on the street with them, who have very little residual ability to deal with stress themselves, and so they aren't really much of a support system. Previous childhood trauma, the more they had, the more helpless they felt, the more this next event is going to be traumatizing. And then also having other mental health problems, depression, anxiety. But the big one is alcohol and drug abuse, because that's going to distort how they process the event. And also, alcohol and drugs are going to be a form of self-medication. Um, Alcohol does relieve anxiety. And so you'll see a lot of people with PTSD having severe difficulty and a compulsive use of alcohol. Women are twice as likely as men to develop PTSD. And the reason that women are so vulnerable is men. It's the uh, uh, intimate partner trauma that whether it's sexual abuse or rape or basically just being taken advantage of, domestic violence. Um, Women have to put up with that or experience that. And so that's why they have double the risk of having full blown PTSD. Um, the reactions to intimate partner violence, the technical term, is much more severe and impairing because of the betrayal of trust. By definition, there was a trusting relationship, and to their peril, it falls apart on them suddenly and repeatedly. Most domestic violence is something that has been repeated over and over and over, and a lot of women have a hard time actually being able to make the decision in their own minds that this is abusive, this is violent, this is wrong, because it occurred in a quote loving relationship. This sense of betrayal of trust gets generalized then to the entire world. Um, Everything becomes a threat. No place is safe. Um, and so once again, you're on your own without a support system. Trauma at the hands of a parent is pretty much the same sort of thing, except that it happens at a much earlier age. And the child has absolutely no alternatives to find another place to live. They really are stuck.
That is all so fascinating. And I feel like I've witnessed and experienced so many people who seem to be dealing with PTSD, some sort of effects of trauma in their life. This feels very, very applicable to the people that we interact with on a daily basis. And it's really interesting too, because I have noticed that people who end up on the streets, many of them have already experienced some kind of trauma. And then, as you were saying before, living on the streets often induces more trauma because things happen, people get hurt, people get harmed, their stuff gets taken, they don't feel safe, they don't feel stable, all of these things. So it's interesting to see people kind of progress and change the way that they're interacting with the world, the way that they're carrying themselves as a result of this kind of further trauma of being on the streets. So thank you so much for sharing all of that. How can our volunteers respond to someone when they are experiencing some sort of memory of a traumatic event or are triggered by something in some way? What are good things that our volunteers can do in response?
There are three major modalities. And here, the person at Dry Bones who is the master of this is Joyce Garrett. She is so good. If you have a chance to talk and learn something from Joyce, you're an extremely lucky person. She knows more than anybody I've ever met. But basically, what Joyce is going to start with is self-soothing. That's one of the problems, is that since childhood, there was not only not someone not there to protect them, there was not anybody to help talk them down, bring them down, provide stability, provide safety. And so that ability to soothe and be soothed is missing in most of our friends. What Joyce would do is she would teach them breathing techniques. And that sounds like nonsense. um, Everybody breathes. This is more a distraction away from the fact that they've suddenly become immersed and indeed overwhelmed in the re-experiencing of their trauma. These are people who are literally drowning in their own emotions. And so it's a way of actually changing the subject, getting them to turn from the experience into something just so basic as breathing. And it actually can be a very powerful and useful technique to know, not just for our friends, but for our own lives. We all end up, well, at some point or another, need to know these techniques for ourselves. Um, Also, meditation, mindfulness training is a way to just from day to day turn down the volume on the adrenaline system. Um, You try and keep people out of that panic level where everything just disorganizes. They lose contact with their ability to problem solve, and they're just a scared, overwhelmed little child at that point who can't get themselves out of it. Cognitive restructuring, and choosing your responses is a third way to do it. Um, being able to, for somebody with PTSD, on a scale of 1 to 10, everything's a 15. There's no moderation in that. So helping somebody pull back from the event and start thinking about it intellectually, analytically, can often be very helpful. But don't miss the basic stuff. One of the first things that Joyce does with everybody is gives them a glass of water, because in her experience, most of our friends, when they get off into one of these events, are dehydrated, and they're not aware of it. And the next thing she does is she gets them something simple to eat, because usually their blood sugar is a bit low. Also, being fed is just a basic caring experience that'll counterbalance being attacked. So again, very simple grounding things. The third major modality is one of the things that Dry Bones does particularly well, and that is supplying a healthy, secure um, group to which a person can become attached. I recognize that for many of our friends, they've never had it. They don't know what it's like. Their families, rather than being a source of protection and support, were the very people they had to watch out for most. The alcoholic, abusive father, the drug addicted mother, they have not had a supportive family. And so being able to have a group of people that they know are there for the long run. This is one of the great strengths of Dry Bones. Is it's not sort of hit and run, or you don't age out of it when you're 18. There are some friends that, even though they're referred to as kids, are 43. Um, but emotionally, psychically, they're still kids. And the third thing, and this is one of the things that the volunteers supply very well, and that is just being able to tell your story to someone who gets it, who's not going to be offering either uh, things to go do, to go fix things, or trying to figure out what you did wrong or something like that. Having somebody willing to listen to your story and not try to change you or fix you or something like that is tremendously therapeutic. In fact, that's one of the few things that's been known to work, is you tell your story so many times, so many people, that you ultimately just sort of have expressed all of the fear, all of the anxiety, and you get bored with your own traumatic story, and then you're able to move on. So this may be the 10,000th time they've told their story to somebody, but if you listen and you're attentive and you show that you care, it's therapeutic. We also know what not to do. Uh, that's just as important. Statements that are dismissing, delegitimizing, such as, "Oh, you'll get over it," "Oh, that's not that bad," no, that is not helpful. Um, it's the it's heard by our friends as just another way of saying, "I can't be bothered with you." Um, just sit there, listen. You don't have to say anything. Uh, you can go, okay, that must have been very difficult for you. Again, validating type of things to encourage them to tell their story to another human being. Listing what the victim did wrong. So often when, and this, the police are famous for this, the perpetrator is no longer there. That happened in their childhood or something like that, or it happened when you got drunk at a party or something on that order. The perp is not there anymore, so the other person finds out what you did wrong. If you just hadn't done all those things wrong, you wouldn't have been hurt. And this is blaming the victim, and it really discourages somebody who's had trauma from ever telling another person. So again, sit, listen, be quiet. And the third thing that doesn't work is encouraging people to use willpower as a way of dealing with this hyper-aroused traumatic state. That which we feed grows. And so the more we try to, just by sheer force of will, to push these things down, it actually feeds them and they get worse. So that's something that is very important to remember, is that willpower and our emotions have nothing to do with one another. They don't touch at any point. So the admonition to try harder is experienced by our friends as somebody who's setting them up to fail again. It's kind of stupid to say, because it presumes that our friends have not been trying for the last decade to deal with these things. They have. They've done everything they can think of and more, and the traumatic event is still there. The response to the traumatic event is still there. So anything that smacks of being told to try harder is actually going to be really off-putting and detrimental. The other things that don't work are medications. There are no medications that are FDA approved for the treatment of post-traumatic stress disorder. They've tried everything under the sun, and it just really doesn't work. For one thing, trauma turns on every neurochemical system in the brain. And so having something like a benzodiazepine that hits just one of them, the amount of good it does is so insignificant that you can barely detect it. The one that I do use, and that it doesn't have a very good effect, is a beta blocker, actually the alpha blocker, called prazosin, which blocks the effects of adrenaline. And it's by no means curative, but it pulls people back to where, when they're triggered, they're not completely overwhelmed by their inner experience. That's not much, but it's very important not to be constantly being overwhelmed.
All of those things of what to do and what not to do are so helpful. So helpful. Thank you for sharing that. In trying to help our friends experiencing homelessness, um, what do you think that our volunteers' goal should be? We often say that our goal is not to fix people. Our goal is not to change people and make them into the way that we want them to be. Um, but what do you think our goal as a community and as volunteers specifically, what our volunteers can do? What do you think that their goal should be in seeking to interact with and support our friends?
Well, the first thing to remember is that as volunteers, you don't have to do anything. What Dry Bones wants you to do is to be something, be there for the people. These people have just incredibly complex lives. Their lives read like a very long novel. Um, they have experienced every type of trauma you can imagine. They have spent their lives trying to deal with it and have not dealt with it well. They wouldn't be homeless. So that's why it's important to remember that Dry Bones is there for the long haul. These are not simple or trivial problems. They are not going to have simple or trivial answers. It's going to take years and years for these people to be able to pick up where they left off as children and grow into competent adults. So what you can do is just be with the friend. Um, Being alone when you're threatened, when you're feeling helpless, when you're feeling overwhelmed is one of the worst things in the world. Um, I always think that prayers really capture a lot of human need. And so I think of the Hail Mary, which ends with Mother Mary, comfort us, Mother Mary, pray for us now and in the moment of our death. Yeah, the whole thing is be with us. Just be with us. Because what I'm going through now is the equivalent of dying, that big. Um, and so just be with the person, let them tell their story. You can be an observer for the friend. When somebody's triggered and they're gone down the rabbit hole into one of these re-experiences of trauma, think about what you were like when you were in an automobile accident, scared to death. Just how sharp were you in your thinking? How analytic were you? You weren't at all. Um, so when our friends are in these periods, they really don't have much self-awareness, much self-appraisal. And so you can just feed back to them the fact, you seem totally overwhelmed just by the memory of this. So that they can sort of pull back and go, I'm overwhelmed. And they can't make that type of basic association. Um, that sort of thing. Or you can say, um, it only takes small things to trigger a big emotional response. You just making simple statements about what's going on here. Nothing, no blinding glimpses of eternal truth. Just simple observations is what the person can make use of. Third thing is offer them some water and something to eat, if it's available. Um, that's a very human interaction. It is not one that's threatening. It's one that's supportive and sustaining. And most of these people are very hungry and very dehydrated. So you're going to be doing a tremendous amount of help. Seems small, but it's a very, very helpful thing to do. Just the gesture is. Fourth thing is ask for help. If you're sitting there going, holy shit, I have no idea what to do. I worked in my first 2 years in psychiatry residency. Um, uh, ask for help. There's usually staff pretty much around whenever you're there. And this is their job. This is what they do for a living. This is what they've chosen as a calling. And they're very experienced. Ask for help. Um, will you come in and help me talk with so and so who's very upset? I think you'll find the staff is very, very receptive to that. You're not bothering anybody. That's what they're here to do. And so finally, just remember that our friends' lives are very, very complex. They're approaching them with very little resources of finance, of homes, just a roof over their head, where they're going to get their next meal, whether they have job skills and things like that. Um, the the few meager resources they have are devoted to survival, and they're dealing with surviving day to day. I hope I make it through tonight, type of thing. So no, don't try to fix anyone. Just be their companion for now, and that is by far the most therapeutic thing anybody can do. So, thanks for listening. I hope this has been helpful, and I'll be back for other other subjects too. So thank you very much.
Dr. Dodson, thank you so much for sharing all of your wisdom and knowledge and experience. There are so many things in what you just said that ring very true of our community and our experience in the dry bones community. So thank you for sharing that. It's a lot to digest, and I know there's a ton more that we can learn. So we look forward to talking with you again in the future.
Great.
Yeah, thank you so much.